Hi, I am Girish Kishnani, and you are watching 5-Minute Learnings. Welcome to the 13th video in the series on personality. Today we will explore the MMPI test. The Minnesota Multiphasic Personality Inventory, MMPI, is the most common psychometric test devised to assess personality traits and psychopathology. This data can be used to draw conclusions about the test taker's psychopathy or to interpret psychological characteristics compared to the norm. The most common treatment application of the test by providers is establishing or reevaluating care for an ambiguous clinical picture for psychiatric management. This aids in creating generalizable data relevant to a plethora of possible conditions. The MMPI was developed in the 1930s and published through the University of Minnesota in 1942 by Stuart Hathaway and Charley McKinley using visitors of patients at the University of Minnesota Hospital as a base sample in both theorizing constructs of psychiatric illness and fielding the instrument. Testing is administered through 567 true or false items using a booklet with an accompanying answer sheet. The responses are then hand-scored and plotted on an XY graph. A separate version is used for male and female respondents. The x-axis comprises of 14 scales. The first 4 content scales judge the validity of the test attempt and include (?) to represent the number of questions completed incorrectly, either with no attempt or both true and false selected. L for lie, to represent an attempt by the respondent to misrepresent themselves in a more positive light. F or frequency, to gauge random response as well as the respondent's exaggeration or downplaying of symptoms. K, to gauge defensiveness or evasion of stressful content. The 10 remaining scales known as clinical scales are designed to measure for the presence of psychiatric syndromes, including 1 or HS for hypochondriasis, 2 or D for depression, 3 or HY for hysteria, 4 or PD for psychopathic deviate, 5 or MF for the continuum of masculinity-femininity, 6 or PA for paranoia, 7 or PT for psychasthenia or obsessive-compulsive tendency, 8 or SC for schizophrenia, 9 or MA for mania, 0 or SI for social introversion. The y-axis statistically standardizes the grading received on each scale in a range of t-scores from 0 to 120. A mean score is 50, and 82% of respondents are considered the normal population, falling between 30 and 70. A t-score greater than 70 indicates psychopathy in that category. Issues of concern. The existence of the MMPI has been concurrent with vast reforms in societal convention and increased understanding of behavioral health. Likewise, the instrument has been adapted to reflect such changes. Overarching criticisms to the original test center on its disparity in addressing psychopathy in social and ethnic minorities. This has been attributed to the original sample being a small group, mainly consisting of young rural Caucasian subjects from the Midwestern United States. Studies have established biases in which misunderstanding or failure to identify with the content of questions culturally has led to underreporting or overreporting mental illness. These shortcomings led to the release of the MMPI-2 by James N. Butcher, W. Grant Dahlstrom, John R. Graham, Octelligen, and Beverly Kemme in 1989. This assessment retains the original total of 567 items with the same corresponding 14 scales with the original number of questions from the test. Test items were revised based upon a larger and more diverse sample size of 2,600 attuned to a 6th grade reading level. Gendered differences were replaced with a non-gendered standardized scoring. Despite further advancements, the MMPI-2 is still the most commonly administered version and has been translated into over 40 languages. There had been more revision in the inventory scales in 2003, 2008 and 2020. I am consciously choosing to ignore them as they will dilute the very purpose of understanding the MMPI. The MMPI provides broad information about aspects of personality and the existence of components of psychopathology, but it's used in other areas, such as legal cases, including criminal defense and custody disputes, professional/employment screening, especially for high-risk jobs, substance use programs, interpretation is based upon scoring reasonably truthfully and consistently within the outlined scales of the test. Scales in older versions represented clinical syndromes, while more recently developed scales are based on identifying symptoms that can be applied to appropriate conditions or disorders. The completion of the MMPI holds value in determining care throughout a variety of treatment considerations. The test should be administered by a licensed psychotherapist. The MMPI can be a valuable tool in assessing the psychological status of a patient. It will be ordered by a psychologically trained clinician but can provide crucial information to many members of the interprofessional healthcare team, including family clinicians, psychologically trained nursing staff, social workers, and counselors. Specifics regarding its use will vary depending on the clinical situation, and it needs to be part of a more complete evaluation to help direct therapeutic interventions and drive optimal patient outcomes. That's all for today on MMPI. In the next video we shall explore the Big 5 personality test. Hope you found this video helpful. If you liked it, please give me a thumbs up, and subscribe to my channel 5-Minute Learnings, and do remember to hit the bell icon to get notified on new content. Thanks for watching.